common anxiety for patients is how much pain they're going to have after the surgery. With modern hip replacement surgery, there's a real emphasis on enabling patients to mobilise as quickly as possible after surgery, often on the day of the surgery. So good pain control is really very important as part of this. Some patients undergo what's called a spinal block, and this allows patients to have good pain control after the surgery as it slowly wears off. Modern hip replacement surgery has a real focus on minimising the trauma to the tissues around the hip, and so subsequently minimising the pain after the surgery. Often local anaesthetic can be infiltrated into these soft tissues to try and assist with this pain control afterwards. After the surgery has been completed, something called multimodal analgesia is used, and that's a combination of different painkillers and anti-inflammatory medications which all work in a different way and so can control the pain as well as possible. Usually within 24 to 36 hours after the surgery, the strong pain-killing drugs can be stopped and people can have simple painkillers to allow them to mobilise and to take home. It's important to carry on taking these once patients have been discharged from hospital, as it will allow them to sleep better and it will also help with their ongoing mobilisation, which is very important for the recovery after a hip replacement.